Well, historic late planting continues to weigh on farmers' mental health as weather delays keep them from the fields. The AgriSafe Network is now working to provide resources to help protect the people who feed the world. Joining us now is AgriSafe Executive Director Natalie Roy. Natalie, thanks for taking the time to join us this morning. How does the organization impact the health and safety of farmers and ranchers?
Thank you, Janet, for the opportunity to talk about that. Our tagline is protecting the people who feed the world, and that's a big job. We recognize that farmers and ranchers face a lot of health disparities, and so we access our great rural health providers as a way to leverage the trainings and the services that farmers need. So those health providers that are in rural America, your doctors, your nurses, your pharmacists, if we get them trained to care for farmers and ranchers, then we're doing our job. We're helping to protect those people. And so we provide a lot of resources and clinical instruments so they can do the job of providing occupational care. Unfortunately, most health professionals don't get training in this field when they go to school or medical school or nursing school, and so that's what AgriSafe brings to the table. We train these doctors and nurses so they can address those occupational health issues. We want to make sure they do it in a holistic way as well, attending to their mental health and their physical health needs.
So what is Total Farmer Health and how does it support mental well-being?
Total Farmer Health is a campaign that AgriSafe has adopted, and really, if you think about it, it means that we need to look at both the mental health and the physical health of a farmer. And so that means that we need to pay attention to things like, are they able to access that support network if they're struggling with mental illness or stress that they're not able to cope with. So to be achieving Total Farmer Health isn't just about removing hazards in our agriculture, like making sure that PTO shield is on or the ROPS is on the tractor. To achieve Total Farmer Health, we have to look at things like, are they getting access to good health care? Because we know mental health shortage areas are a real problem in rural America. Are they able to accommodate or adapt to fluctuating market prices? So when the finances aren't where they expect it to be, are they able to make those adjustments? So Total Farmer Health requires us to look at the whole person and to be able to address each of those health disparities with the right focus.
Now, Natalie, of course, AgriSafe has a series of webinar trainings. How can folks register and participate in these events?
Yeah, we've got trainings for our rural health clinicians. So, for example, July 9th, we've got a great one on having that tough conversation in that clinical setting. So if you're a doctor or nurse in rural America, make sure you attend that. They're free trainings. You access it by going to agrisafe.org. We've got a great learning library where you can access almost 100 different trainings on your own time, and most of them are free to access.
All right. Well, Natalie, thank you very much for joining us. We appreciate your time. AgriSafe Executive Director Natalie Roy joining us from our Washington, D.C. News Bureau this morning.